Hey everyone, Happy New Year and Happy 2022. We've been away for a little bit. I've been under the weather a little bit as well, but you can see where maybe I've been recently. So back in December, I took a little trip up to Calgary, take a trip to Lake Louise and Banff. And up there, when we walked into the Lululemon store, they had these specially designed things for the Canadian Olympians. So I thought it was pretty cool. So we're wearing it today. Just a little relaxed day in the office today. We're doing some cleanup work and some Zooms today. No in-office consults or no in-office treatments today. It's just you and me finishing up some Zooms, and then let's do a little fun YouTube video, okay? When we return in a bit. Fillers, although as providers and although some patients find it as the easy thing to do, lip fillers, cheek fillers, no matter what you decide, just pumping in some fillers. But one of the questions I ask if a patient comes to me and they've had fillers in the past is, what fillers did you get there? And they'll either tell me, I don't know, or they'll say, hey, maybe I got Juvederm, maybe I got Restylane. And at that point, I'll ask them which Juvederm, which Restylane, and that's when they go foggy. What people don't realize is Juvederm, Restylane, and a couple other things that we'll talk about are just brands. Within those brands, there's many, many, many different options. Just like if you were to get a Mercedes, well, did you get an S-Class, an E-Class, a so on and so forth? Did you get a BMW? Did you get a 1, 2, 3, 4, 5 series? So that's what it's like when you get fillers. You're buying the brand, but also within the brand, what specific product are you getting? So just within the Restylane brand, I'll show you what varieties there are. You have Contour, you have Refine, you have Define, you have Kiss, you have Lift, and then you even have two more, which is Silk and the original Restylane L. Which in Juvederm, I'll grab a couple that I have offhand here. You have Voluma, you have Ultra Plus XC. If I cover this, you have Ultra XC, you have Velour, you have Volbella. I know I'm missing one of them off the top of my head. But you can see the many varieties that you have when it just comes with these two brands alone. So we providers have so many things to choose from, it's going to be very daunting for you as a patient, as a client, to try to figure out what is best for you. So that's why it's very important when you have that dialogue in regards to your lips, your cheeks, that you have a full understanding of why that provider is choosing this for you. Are they choosing it because that's the only line they carry? Are they choosing it because they're trying to get rid of some fillers? I don't know, I'm just making stuff up at this point. But always have that understanding of why are you using this filler specifically for this purpose. Now, although you've been recommended Voluma, maybe you've gotten Voluma for multiple sessions and you like it, that may not be my preference. For example, Voluma for me, I want to put it where I want a lot of volume, but I want stiffness and firmness and longevity. Cheekbones, I want those to last as long as possible. I want it to be as firm as possible because this is a very firm area. I want as much cheek push as possible. But if I take that same product that's very hard, very firm, the lips are very soft and very mobile. I don't want to use a very firm, hard product in the lips. Granted, you may want huge, enormous lips, but one, they're not going to look good, and two, they're not going to look and feel natural. Now, if we use the example of lips, I give people usually a couple options. One, are you tied to a brand? If you're tied to a brand, we here carry all the major brands, the Juvederms, the Restylans, the Versas, we carry them all. Now, within those brands, let's decide which one is fitting for you. Are you a first-time lip filler? Do you want something subtle? Are you looking for something big and in your face? Or are you looking for something that just naturally pushes out your wrinkles? So those are the discussions that we have. Now, when it comes to products, I give you options again. Baby bear, middle bear, upper bear, and then also that point that most people don't want to talk about is price point as well. Most of these are name brands. We have a couple other ones that they're not name brands, but what happens is they don't have the name recognition that someone else may have. So although you're paying for a lesser price point, we only carry products that are FDA approved here and then carry products that are appropriate for you. So that's never an issue when it comes to, am I using a product that's safe? Am I using a product that's FDA approved? Because we're always using stuff that's FDA medically approved. But if we just look at the Restylane line here, I'll grab 3 of these. These are your Kiss, Refine, Define. So there we go. I'll put them in order. Refine, Kiss, Define. So this comes from their expression technology. Expression technology, which I'll link a description below, is their technology of products that are placed in area that move. especially around the mouth area. When we smile, the smile line curves. When we smile, the marionette curves. When we smile, the lips move and animate. So we want to use a product that moves with expression, and this comes from their expression technology line. Within that line, you have Refine, which is the softest and the most pliable, but it doesn't have a lot of strength and it doesn't have a lot of size. Next comes Kiss. Kiss is probably my gold standard when it comes to lips for most people, because it's a good middle ground. It gives you enough of a pout, it gives you enough of a push where you see a difference, but it doesn't overwhelm you where you fall into that category of that fear of people saying, I don't want to look fake. Now, we'll go into a different video at another time in regards to what's looking fake, but also link into the description below or this card in the upper corner on how I define fake. And I think that's a misnomer, and how it's just a word that I don't like to personally use, but I understand the fear factor that goes behind it when it comes to looking fake. But Kiss is probably my gold standard when it comes to lips, just because it's a great middle ground. Define for Restylane is probably the biggest product I use. Now, you as a client may need 1, 2, 3, 4, 5 syringes in your lips. Maybe that's an exaggeration. However, I always start with 1 syringe regardless. Now, someone might ask me, why don't you use half syringes? Why don't you use a quarter syringe? Technically, we could, but we still have to fill the entirety of your mouth. So although we could use half a syringe of Define and try to blanket your mouth, but I'm not using enough product to fill your mouth. I'm just trying to use a very big product to get you to where you want to be. But again, I'm not using the appropriate product. I'd rather use a smaller product, such as a Kiss, a smaller product, such as a Refine, to make sure I cover enough of the surface area of your mouth to give you the proper look and the proper elevation and the proper softness while not overdoing it. Now, why does one practice choose Juvederm? Why does one practice choose Restylane? Maybe within the same practice, you've gone to a couple of different providers within the same practice. Why does one choose Juvederm? Why does one choose Restylane? It's very similar to how we just had that long conversation. Every provider has their preferences as well. And as long as that provider can tell you, dictate, or educate in a way where it makes sense to you, then that is a valid reason. Juvederm I usually reserve for younger people because I think it gives more of a youthful pout. I use Restylane generally in the older population because I think it holds a little more structure. I'm trying to create a lip that just isn't there anymore. Now, those are generalities. I can interchange Juvederm and Restylane based on the client itself. But those are some of the nuances that I think about when I'm thinking about Juvederm versus Restylane. If you've ever seen me in practice or you've seen all the products that I've used on you, you may have wondered, why does he use Restylane? Why does he use Juvederm? Man, he's all over the place. And that's, for me, a beneficial thing. I'm not tied, I'm not married to any one manufacturer. I try to use the right product for the right person, for the right place. You come back to me one day and you tell me, hey Con, I'm tired of coming back to you every 6 to 9 months to keep blowing up my lips. At that point, we can decide, hey, okay, why don't we just go bigger in one session, and then it will dissolve a little bit slower over time. Granted, you may have extra big lips in the beginning, but at least you'll have a little bit more longevity. So there's one last thing that I forgot to mention is how do I decide which fillers to put into an area is what products do you have there in the first place? So the fillers that we talked about right now are hyaluronic acid fillers. Now, if you've had Bellafill into a certain area, if you had Sculptra into a certain area, and even if you had a certain hyaluronic acid filler into a certain area, that will help me decide whether either one, I'm putting a filler there in the first place, or which ones I want to put. So imagine if you had Bellafill, and we can talk about Bellafill at another time, and you had Bellafill placed recently, or if you had Sculptra placed recently, then I likely will not put any new filler into that area because with Bellafill and Sculptra, they act differently and they're long lasting. So before I put anything new in that area that prones you and puts you at a higher risk for lumps and bumps, I would hold off on it. Now, if we go back to the example of lips, let's just say you had Juvederm Ultra within 6 months, but I wanted to put it in Kiss. I'd probably be a little hesitant as well because I've heard a couple reports where Kiss and Ultra don't play too well together. Now, if you do develop lumps and bumps, the benefit of hyaluronic acid is we can always dissolve it, but that's another key indicator on whether I use a new filler or an old filler to put into a certain area for you. Hey guys, and thank you for tuning in on this little short conversation about fillers. We talked about Juvederm, we talked about Restylane, we've even talked about Versa and a couple other fillers. So that was just a quick and easy example of how we use fillers, where we put it, why we put it there, and then how we choose brands. And within the brands, how do we choose the specific product itself? So in the end, it's always about choosing the right product for the right person. And then also it's about making sure that the products play well together in regards to what product you've had placed there in the past. So again, make sure you hit a subscribe, make sure you hit that notification icon, and always give it a thumbs up if you appreciate these type of videos and the education that we put out to everyone else. Just by putting that thumbs up right now, you push this video and you push this algorithm to other people who may find this useful as well. And in the end, we always make these as educational videos for you to learn from, and you become more prepared when you come see us in office. I'll talk to you guys later. Stay safe. Happy 2022. Bye.